Greetings to all our viewers, and thank you for tuning in into our monthly series, Katz Conversations, where we take a deeper dive to get to know our women's health experts on a more personal level. I'm your host, Sharon Zarabi-Fern, and today I have the absolute pleasure of meeting with Dr. Mala Sachdeva. Dr. Sachdeva, I'm going to just jump right in. If you could share with us your title and a little bit more of your role of what you do with Northwell and the Katz Institute for Women's Health.
Sure. First of all, thank you so much for inviting me to do this. It's my pleasure to be here. So I am part of the Division of Kidney Diseases and Hypertension here at Northwell. And I have two subspecialties. So we do all general nephrology. So I do general nephrology. I have my dialysis patients, my chronic kidney disease patients, my post-transplant patients that I take care of, and my peritoneal dialysis patients as well. So two of my subspecialties are obstetric nephrology. So that's taking care of pregnant women with underlying kidney disease, hypertension, preeclampsia, fluid and electrolyte issues, either prepartum, postpartum, during pregnancy. And I'm also medical director of the home dialysis programs at North Shore and LIJ.
Okay, well, I am glad that you introduced yourself that way because that is a mouthful of titles. So congratulations on everything that you do. And, you spoke about so many different areas that target women, the obstetric side, the renal side, dialysis. And I can only imagine that when a woman is pregnant and going through the hormonal changes of carrying, a fetus, and then you have this whole dialysis or renal issues. It sounds like you manage a lot when it comes to women. What would you say is like the most rewarding part of your role in the medical care plan?
I really enjoy taking care of my pregnant women with underlying kidney issues. So either I'm taking care of them prior to conception and kind of optimizing them for their pregnancy, for their planned pregnancy, or I'm meeting them for the first time during their pregnancy where an underlying kidney issue is being unmasked, or their blood pressure is worsening and they're sent to me, or they have fluid and electrolyte issues, or they're being diagnosed with preeclampsia and the OB has sent them to me, or I'm meeting them postpartum. The most rewarding part for me and the biggest challenge for me is taking them through their pregnancy for those 9 months, supporting them emotionally, mentally, and medically, and then seeing them deliver and having that successful pregnancy. So that's a huge reward for me when I see that this hard work between the two of us and other disciplines as well have gotten them through a successful pregnancy. And then the other rewarding part of it is post-pregnancy, postpartum, when I'm seeing them with their newborn babies.
Right.
And then following them through time with their kidney disease, seeing their children grow up, and maybe even then optimizing them for a next subsequent pregnancy.
Right. So you're with them for a long period of time. And you just spoke about being part of like a multidisciplinary care team. You're not doing this alone. You're doing it with a larger cohort of medical professionals.
Correct. And I think it's creating that connection with the patient that's really, really rewarding through time. And then allowing also that patient to see that we're working as a team for them. So creating that multidisciplinary team, either it's during their pregnancy, working with the cardiologist, working with the rheumatologist, working definitely with the high-risk OB group, working as a multidisciplinary group and team for the patient is very rewarding, and that's what we're showing them.
Okay, so I can only imagine with the different types of disciplines that you're working with, taking care of the patient, and then having your own personal life. I mean, I always say when we're doing these interviews, you're still human. You still have your life or children or family. We have so many viewers, and I think, they look at physicians as superheroes. There's a lot of burnout. How do you manage your work-life balance?
It's hard and it's a struggle, right? And I think for women, it's even harder. And it's more of a struggle at the beginning of their career. So a lot of women are starting their careers, but also starting their families, right? For example, I started here a little more than 15 years ago at Northwell, and I have a 13-year-old and a 14-year-old boys, teenage boys right now. But you can imagine when I started, right, that struggle was real,
Yeah.
right? So it's very difficult at the beginning. And two things I've learned is that you have to prioritize work and family and kind of figure out where your priorities are. So at the beginning, my priorities obviously were work and family, and I tried to get that balance. So you have to prioritize on a day-to-day basis. You have to then prioritize on a weekly basis, on a monthly basis, and
Mhm.
kind of try to achieve that balance. But with the priorities comes adapting to life. So life changes, family situations change, children get older, needs change. At the same time, work changes, schedules change, you have to adapt. So I think both with prioritizing life and then also adapting to either work and family can help you try to achieve that work-life balance. And it's not easy. It's a struggle. It's not easy at the beginning. But what I tell everybody, all my fellows, all my residents, all my junior colleagues, I tell them, they look at me and yeah, they say super mom, super, but I tell them it comes with time. Don't give up, keep up with the challenges. Don't take the path of least resistance, that it comes with time and they're going to be fine.
Okay, those are actually very powerful words, and so much of what you say resonate where I am in my personal life. Just again, working, being a career woman, also working for Northwell for over 18 years. But you said you have two sons that are almost a year apart from each other, and I can't even imagine when you were, two under two can be very difficult. So these are all great. Prioritize, and nothing is forever, and these stages are temporary, and be nimble and adapt. How do you, on a day-to-day basis, manage your well-being and prioritizing that? Do you have a calendar? Do you go to the gym? Do you drink wine? How do you handle and juggle all of that when you're not in the office or caring for your patients?
And that's hard too. Very, very, very tough question, very difficult. Trying to manage that mental and spiritual well-being, on a day-to-day basis. My day-to-day schedule is I'm picking up my kids up from aftercare and school, coming home, cooking, household chores, taking them to their activities. But everybody has to take that time, which I call me time. And you have to have some me time. Either it may not be possible to have that on a day-to-day basis. It may be possible to do something really nice for yourself on a weekly basis, but everybody needs some me time. For me,
Yep. What is your me time?
yeah, yeah. For me, I try my best to exercise, go on my Peloton, listen to music at the same time. And those on a daily basis, or even every other day or every couple of days, can give me my me time and my relaxation.
Okay, great. I hope some of our viewers are taking some notes here. And if you did not go into the field of medicine, where else do your passions lie? What do you feel that you would have done?
That's a great question. So when I was in high school, I used to say I loved art. I loved drawing. I loved writing, and I loved cooking. So I used to say I was going to be, when I grow up, I was going to be an artist, a writer, a cook, and a doctor. So the doctor part of it came from my parents being first generation immigrants and didn't give us a lot of choices and in terms of what career we needed to choose. For them, it was okay, choose either being a, dentist, doctor,
Yep.
lawyer, engineer,
Yeah, I think many can relate to the same as first
yeah,
generation immigrant parents. Yes.
yeah. So choose something like that. So I always said, okay, I'm going to choose one of those, but I also want to write, to cook, and to draw.
And do you do any of that on your free time? You know, you spoke about me time, and do you have any arts and crafts or things in your home that you do for yourself?
So the writing part of it comes, being in academics. So being in academics, we're always trying to write papers and case reports and articles and so forth. I do have a textbook that's published. So
Congratulations.
thank you. So the writing part is still being fulfilled as, as every day goes by. The artist part of it, the drawing part of it, that's a hobby which I plan to incorporate at some point in the future. The cooking part of it, I enjoy. I love cooking. I can't cook all these fancy dishes on a day-to-day basis because of all the running around that we do. But at least once a week, I try to look up something interesting, fresh ingredients, interesting recipe, and I try to cook it. And I love just seeing people eat the food and commenting on the food. And
Right, so it looks like you love to take care of people around you, and food is always the way to, someone's heart.
it is.
All right, so we're going to go to the next portion of our conversation here, and it's going to be called the rapid fire, where we ask you a few questions and you just answer with the first thing that comes to mind. There is no right or wrong answer. This is, again, us getting to know you a little bit deeper, and we got some information about some of your likes and dislikes and passions. So you mentioned you go on the Peloton, you listen to music. So favorite artist or favorite band?
You know, forgot the name of the artist, but there was just a song that I kind of fell in love with recently. It was from the movie It Ends With Us, and I'm forgetting the title of the song too.
Favorite dish that you love to cook when you actually do have the time and can take advantage of that?
I'll cook salmon. I've cooked salmon, my kids' favorite. And when their friends come over, I'll cook for them. When, my friends have come over, I will definitely have them try this dish. I think that's my favorite dish I like to prepare for others.
Okay. Favorite side that accompanies that dish? Are you a vegetable person or a starch person?
So I'm a vegetable person, and I have to say the favorite side would be broccoli, and that's because my son loves broccoli.
Sweet or salty?
Definitely sweet.
Okay.
Anything chocolate.
Anything chocolate. All right. So that was my next question. Chocolate or vanilla? It looks like you're going.
Oh, anything chocolate. I will melt.
All right. So now any of your patients will know what they can gift you with when they come to the office. Well, this was fun. Dr. Sachdeva, thank you so much for your time. Do you have any other closing remarks that you'd like to share with our patients? I mean, it sounds like you were very inspiring, just sharing your personal struggles as mom and doctor and starting so young in your career. But I'm going to leave the closing statements to you.
Yeah. You know, everybody struggles in life, right? Everybody experiences ups and downs. Everybody has a battle to fight. You just have to remember that you have to fight your battle and keep on going. Be strong, keep on going. The second thing I think that's important is finding a physician that you can connect with. And I think that's really, really important when someone's taking care of you. Find a physician that you feel you can talk to, socially, emotionally, and medically, and that is listening to you. I think one of the very, very important characteristics of a physician is you have somebody that will listen to you. And just going off on a tangent, I do tell that to my fellows that and my residents that patients know themselves the best, and what they're saying is the truth, and you have to listen, right? So find a physician that will listen to you and that you're comfortable with. And then once you find someone, don't be afraid to ask questions. And also don't be afraid to ask them to talk to your other doctors, because I can't stress anymore that a multidisciplinary team approach to taking care of you is a big part of your success. So ask your, nephrologist, for example, to talk to your OB. Ask your nephrologist to talk to your cardiologist, to talk to your rheumatologist, because that means success for you. And that's what we try to do here, with Katz in Northwell. That's what we're completely trying to do, create multidisciplinary team approach to taking care of you.
Thank you. I couldn't have said it better. And again, you could be the perfect spokesperson for the Katz Institute for Women's Health. That is exactly what we do. It's providing that expert coordinated care, having that empathy to actually listen to the patient, communicating with them, having them feel comfortable, and being resilient, right? And advocating for themselves. So, so much of what you said is our mission here at Katz. And of course, any of our viewers can find those specialists on our website through the Find an Expert page. So you are listed there along with most of your colleagues. And Dr. Sachdeva, I have to really thank you so much for your time and opening your heart and opening your personal stories and life to me and our viewers. And I look forward to seeing you all at our next Katz conversation.
Thank you so much.
Thank you.